had good seizure control, it was like flipping a switch. Andrew has been on a steady track of improvement ever since then, and he's really making good progress.
How did you feel about taking your baby to a cranial osteopath?
Fine. I didn't know anything about it.
You weren't scared to do it?
No.
You were going to break every bone in his body?
No. I felt better about it. I felt a lot more hopeful.
What?
A strange doctor, pediatrician, said that Dr. Holland would break every bone in his body if I took him to Dr. Holland and had cranial sacral manipulation done. I know it helped. I know it helped.
What else did Dr. Holland do for Andrew?
Do you have all day? Dr. Holland has helped me with medication control. He stopped the seizures through a special cranial release, and Andrew's been seizure-free for many, many months now. Dr. Holland has guided me in the proper channels for therapy for Andrew, and Dr. Holland has just helped Andrew from head to toe in his development, mentally, physically, and he's been a great support to me.
When an osteopathic physician looks at a newborn, they see the child both medically and osteopathically. Problems, however minor, are viewed as functional responses of the child to the stressors it has encountered being born. Osteopathic theory states that although a few children suffer problems before birth, the vast majority of functional problems begin in the birth process. Distortions introduced into the tissue of the skull and the rest of the body sometimes last a lifetime. Worse, many times such distortions and dysfunctions are correctable, but the physicians who care for the child are not trained to recognize them. Most pediatricians are taught to just reassure parents when a newborn's eyes cross, or they spit up too often, or their head is misshapen. These are signs of injury to the soft tissue, and in a baby nearly everything, including the skull, is soft tissue. This 6-month-old baby was diagnosed by her pediatrician as having colic. The child never slept longer than 3 hours, and usually not more than 2 hours since she was born. When she was awake, she screamed and cried as if in pain, and she spit up after every feeding. She arched her neck and back and cried out. Her pediatrician had already subjected her to blood tests, x-rays, and an upper GI, all of which were normal. The mother was exhausted and didn't know where to turn. She knew something was wrong with her baby, but no one seemed to be able to find a cause for her symptoms. Finally, a relative suggested that she see a DO. To an osteopath, there were several features in the case that were important. The labor was long and difficult. Problems began within the first week of life and persisted, and the mother said that the head was very molded at first. The baby suckled well on one breast but not the other, and seemed to have taken a long time to get the hang of suckling. She favored sleeping with her head turned to the right and resisted turning her head to the left. She slept fitfully. If you picked her up when she slept, she cried as if in pain, but x-rays of the neck were normal, so this was dismissed by the pediatrician as unrelated. The baby was gaining weight all right, but the mother looked very tired from lack of sleep. The baby had a distortion of the skull where the head was bent to the right on the upper neck, and the upper neck muscles were having difficulty getting the skull to balance, something we do without thinking about it. This is obvious when you watch her during this first treatment. She had pain in the upper neck on the right and was adjusting to it constantly while I worked with her. Toward the end of the treatment, I was able to get the tissues realigned and balanced, and the profound relaxation that this produces in her neuromuscular system is obvious here. Look at the moment of release. There's a deep breath or yawn that marks the reset of the neuromuscular system. This baby went home to sleep 14 hours and woke up happy and hungry. She never went back into the crying and distress she exhibited before the visit. She was released after 3 treatments and followed up without incident.
You could tell that the pain was no longer there, and she just was a happier baby.
Not all colic is structural in origin, but all babies with colic deserve a good structural exam, as it is a common cause of it and is usually reversible with relatively few treatments. Some osteopathic research indicates that up to 80% of newborns exhibit dysfunctions in the neuromusculoskeletal system, and that 1 in 8 develop problems that persist later in childhood. Osteopathic theory states that dysfunction precedes disease. Left in the system, dysfunctions distort normal growth and development. Unfortunately, most pediatricians do not connect difficult birth, skull distortion, nor the neuromusculoskeletal system to common problems like colic, recurrent respiratory infections, recurrent ear infections, or eye movement control problems. Asthma, ear problems, sinus problems, and other respiratory ailments are sometimes long-term sequelae to birth trauma, which respond well to osteopathic approaches. These approaches have good physiologic strategy and do not subject the child to anesthesia nor instrumentation. They are also cheaper. Unfortunately, they do not help everyone, and this is why an osteopathic physician may use medication, refer for further tests, or ask other physicians' opinion if treatment doesn't produce the desired response. Sometimes a combination is necessary to overcome a problem. Allowing children with known structural problems to go untreated may be potentially dangerous as well. Difficult birth has been linked to behavioral disorders, developmental delay, cognitive deficits, cerebral palsy, substance abuse, and even later criminal behavior. Cerebral palsy literally means damage to the neuromusculoskeletal system and is a hodgepodge of problems that someone trained to work with the neuromusculoskeletal system can often help. Countless children are subjected to perpetual illness, psychotherapy, mind-altering medication, and even surgery for problems that could be more effectively treated at much lower cost by osteopathic approaches. The cost to society and human misery, not to mention health care dollars, is incalculable. The most common argument used against cranial manipulation is that the skull is rigid and unyielding. This is Abby. She was diagnosed by her pediatrician and ophthalmologist with Duane syndrome, a condition where one eye is much smaller than the other. The only treatment option offered this child and her parents was cosmetic skull and eye surgery. They were reluctant to subject their healthy child to this radical surgery, but then they were advised to wait, as they thought that Abby might need eye muscle surgery as well. Luckily, the mother was seeing an osteopathic physician for her back, and when he saw the baby, he referred her for osteopathic treatment. Over the next several months, Abby was treated using gentle osteopathic techniques, and you can see the results in these sequential pictures. still see Abby every 3 months to deal with residual tendencies to distortion in the tissue. But she enjoys a lucrative career as a model, something that she would not have been likely to do had she had surgery or done nothing. A more serious form of distortion is seen when the entire skull is bent, as in plagiocephaly. Plagiocephaly is a condition where skull growth is distorted in a particular way. This condition varies from mild to severe, and there are 2 methods of treatment currently accepted by MDs. Carrie was advised to try helmet therapy for her plagiocephaly. A series of hard fiberglass helmets were fitted by a neurosurgeon to squeeze the skull back to a symmetrical position. She hated the helmets. She and her parents found 4 months of weekly osteopathic treatments much easier to live with and much more effective. Carrie's plagiocephaly was mild, and she developed normally, but sometimes skull distortions cause problems with brain function and development is delayed. In the more severe forms of plagiocephaly, cosmetic skull surgery may be recommended. While necessary in some cases, it is very traumatic and involves surgery around the structures of the brain. Consider Kelly. Kelly had a very difficult delivery. The obvious distortion this caused her is seen in the way her left forehead bulged and her right eye turned inward. She was also setting off an apnea monitor several times a day. Surgery was recommended for what was described as a congenital cranial deformity. From an osteopathic viewpoint, Kelly's skull was bent and needed to be realigned, not subjected to surgery. She stopped setting off the apnea monitor after the first treatment, and it was discontinued after 3 months. Her skull deformity was unnoticeable in 6 months. She stopped having ear infections. So once and for all, let's put to rest the issue of whether or not the skull is bendable or that its shape can be changed with manipulation. It can. Three children could go through an osteopathic treatment program for what it costs to put 1 child through helmet therapy. 50 children could be treated for the cost of 1 plagiocephaly surgery. With tightening healthcare budgets, this is certainly something to consider. The most important and best feature is that quality of care goes up as cost goes down. Unfortunately, the insurers and physicians involved in these children's care are ignorant of the benefits of the osteopathic approach and don't offer it as another strategy for helping children with plagiocephaly. But what if the distortion is more severe? What if it is not compatible with health? What if the baby loses in compensating for the distortion and the system goes from dysfunction to disease? Andrew was a firstborn child who appeared to be healthy and normal for the first 3 months of his life. Born after a difficult delivery, he had skull distortion and right arm weakness after birth, but was released with his mother and showed no outward signs that he had a problem. At the age of 1 to 2 months, he began to arch his neck and cry, awakening at night. At 3 months, he started having seizures and was evaluated at the local children's hospital. He began having 1 seizure after another, and even on anticonvulsants continued to seize. He became limp and would no longer interact. His eyes, once bright with curiosity, diverged in blank stares. His movements were no longer purposeful.
3 or 4 months, approximately, I think by about 5 months old, Andrew, after seeing specialists, made it to a neurologist.
What did he tell you?
That Andrew was having seizures and admitted him right away to the hospital for tests.
What prognosis did he give you for his improvement?
Complete retardation, and that he would be a vegetable.
During a normal labor, as the baby's head descends into the pelvis, the pubic bone exerts pressure against the presenting part of the skull. This is usually the occiput at the back of the skull. If forces exceed the limits of the baby's tissue, one side of the skull gets bent by the pressure.
The old pattern there, although it's much diminished. If you look straight down his face here, the mentum is displaced to his right because the right side was flexed. You can still see the tendency in the vault up here. Excuse me. See how this side of the head still looks a little flatter than this, and this protrudes more. So the whole vault was pushed over to the right side. You'll still see that also in the ears. The right ear is extruded a little bit more than the left one is. The left one's real tight up against the head yet. And yet, if you had seen him a few months ago, this is a tremendous improvement in the distortion that he had at that point. Now, when we sent his EEGs to a pediatric neurologist in Tucson at University of Arizona Medical School, just for fun, when I sent the EEG down there, I predicted where I thought the seizures would be originating, because he had such a tremendous bind in the cranial vault in the left side at the back that there's practically no way that that couldn't be the source of the seizures, and sure enough, that's where they were originating. So knowing that that was the culprit, we started really working to get that left backside to flex. And I won't ever forget the day, but when we finally got that left side to open up and move, his seizure stopped. I ran and told the mother when it happened that he'd had this huge release, and it was right after that he stopped having seizures, and he stopped altogether. He's not on any anticonvulsants anymore. Although we weaned him from them, we kept him on him for a little while just to make sure that he didn't have any more breakthrough seizures. But he went from having seizures constantly on medication to having none off medication. And he's held craniosacral motion ever since then. He's really done well from that standpoint. But developmentally, he started having these when he was about 3 months of age, and he didn't stop until he was right at a year. Is that correct? So he missed 9 months there of having normal ability to track what was going on around him and normal sensory awareness. So what you're seeing now is a child who's catching up, because he's functioning now at probably a 7-month-old level from a motor standpoint. He's doing the things that would be normal in about a 7-month-old. And how many months old is he now?
2 years old exactly.
He's 2 years exactly at this point.
I didn't see his last seizure. His grandmother was holding him one night, and he had a very terrible seizure. And the next morning, they were gone. I didn't see them that whole day, and they have never come back. They were just gone. And it was just before that Andrew was treated by Dr. Holland. It saved this baby's life.
Andrew's case is certainly not unique. Many children seek osteopathic care who have been through the medical system. Many bring CT scans and MRIs which were read as normal, but which show configurational distortions. Because neuroradiologists are taught the rigid skull model instead of one based on biophysics, they dismiss these asymmetries as variations of normal. Consider this child's MRI. As in Andrew's case, her cranium was bent to the right, but instead of seizures, her brain dysfunction manifested as difficulty thinking and speaking. She is autistic. You can see on this MRI that the left temporal lobe sits higher than the right. Note that the patient's left side is shown on the right side of the screen. This asymmetry extends back through the entire left side of the head. The midline structures are shifted to the right, and this pressure causes the falx cerebri, the septum between the lobes of the brain, to be pulled against the right side of the cortex. The compromise of the left side is evident in narrowing relative to the right side. The tentorium cerebelli, the tent-like membrane between the cortex and cerebellum, shown here in red, is elevated on the left by biomechanical distortion. This mechanism is often present in autistic children's MRIs and may account for the abnormal cerebellum reports in the autism literature. To an osteopath, this MRI reflects a serious cranial dysfunction pattern. This MRI was reported as normal. This is Luis Rodrigo, a young boy from El Salvador who was blinded when he was thrown violently onto the back of his head when he was struck by a runaway truck. Luis Rodrigo was neuromuscularly delayed before the head injury, but he could see.
The doctor on Monday, he told us that he, on Friday, he didn't give no 5 cents for his life because he got no hope.
Mexico,
Yeah.
Luis Rodrigo had the
Yeah,
accident.
the accident. So the people in Mexico, they heard, they were worried about him and say, if we can do something. But he was in coma, was nothing to do. And the doctor, they said, he can't fly, he can't be moved. If you do, then it will really die. Now there is a hope. And the doctor told us that after 60 days or 2 months, he could fly after a check, a medical check. And they were penning of us, and they were asking, and if you consider that we can do something for him, bring him up to Mexico, or we can give you some addresses or something like that. And so she gave her the address of Dr. Holman here, and he says it's better you go direct to there, and then later on we will be talking to the doctor up to here. And well, you know what?
Well, tell me how he was when you brought him up here the first time, before Dr. Holland treated him.
Before Dr.
Before he was treated.
Well, Luis Rodrigo was only cries and cries and cries. We didn't know what he cries really.
Was he moving? Or was he just?
No, not in the way that he does now. Because he feels like he feels to us that Luis Rodrigo has a lot of pain. The first time that we came here, but after we left Phoenix and go to Mexico, and Luis Rodrigo has another apariencia.
Looks different.
Looks different. But Dr. Nelson recommended Dr. Holland because when she knew that Luis Rodrigo lost his vision, she was really surprised. She was really surprised, and then she recommended us to come here. And Luis Rodrigo has apparently recovered his vision, because if we move from one part to another, he follows us. He really follows us. And the lady who cares, Luis Rodrigo, 2 days before. 2 days before was moving from one part to another, and she saw that Luis Rodrigo was following her.
This has been since Dr. Holland treated him that he regained his sight?
Yes.
One of the reasons why we accept the recommendation of the Dr. Nelson in Mexico, because she says that with the kind of treatment that the Dr. Holman has, he could recover the sight, because it's an special, the latest in medicine, that he can do something special with the hands, and we are looking for something for him. No matter wherever we have to go. We have friends that they have gone to Korea even to find something for the sight of his child. They didn't get it. Even their son, they lost one eye. So when we learned that something can be done here in Phoenix for Luis Rodrigo, so we didn't doubt. So I sent my wife at that time because I couldn't come. So I sent her here, and when they went back to my country, so Luis Rodrigo looks different. So I felt much better.
They look different.
It was when they left El Salvador, Luis Rodrigo was only on the arms, because he was moveless. When they returned, he was seated on the wheelchair. I couldn't believe it. I thought that he was looking at me, because his eye was open and he was moving the head. It looks so different. So this time I didn't doubt to come again. If I need to come again, I will, because it's a miracle. It's a miracle. The last time before we left El Salvador, this time, the doctor, the child's doctor, he came home, and we were not in home, but he left a note. He wrote a note, and he said, "This is really a miracle. We can see God's hand on him." So it's we have a hope, and we are praying God to help Dr. Holland, to help him, and to have anybody that needs really this kind of treatment. Because
the most intriguing question raised by these cases is, how does it work? We know that the regulation of blood flow and microcirculation is altered after head injury. SPECT scans show marked reduction of blood flow after head trauma. These areas of reduced flow seem to correlate well with cranial dysfunction patterns. Likewise, neurometric brain maps correlate with osteopathic cranial examination criteria, but more research is needed. There are three primary mechanisms by which birth trauma persists. They are direct trauma, hypoxic imprinting of tissue, or HIT, and hypoxic autonomic dysrhythmias, or HAD. Direct trauma is injury caused by passage through the birth canal or by instrumentation during delivery. Hypoxic imprinting of tissue, or HIT, describes distortion patterns in tissue reflecting the position of the baby during moments of hypoxia. Hypoxic autonomic dysrhythmias, or HAD, describes autonomic instability due to compromised initial autoregulatory behavior associated with hypoxia. But the difficulty with osteopathic research into such conditions is that children are not white rats, and it is hard to design double-blind studies without unethically withholding treatment from a child who needs it. What 100 years of osteopathic medicine has taught us is that there are certain risk factors for children with such problems. They include difficult delivery, firstborn, prolonged labor, rapid labor, forceps, induced labor, C-section, prematurity, twins, triplets, etc., high-risk pregnancy, maternal illness, or head injury, even if the head injury is minor. Signs and symptoms you should watch for in your child are difficulty breathing, poor suckling, difficulty swallowing, colic, eye movement problems, irritability, developmental delay, ear infections, recurrent infections, sleeplessness, or muscle tone or coordination problems. Later symptoms include hyperactivity, dyslexia, poor coordination, scoliosis, learning problems, or behavioral problems. Consider the words of A.T. Still, the discoverer, as he called himself, of osteopathy. To find health should be the objective of the doctor. Anyone can find disease. The osteopath seeks first physiologic perfection of form. We look at it, the body, in perfect health, which means perfection and harmony, not in part, but of the whole body. It deserves a chance to achieve his or her physiological potential. Osteopathy offers a medically responsible approach to real preventive medicine. Cost-effective and cost-conscious, osteopathy can minimize medication, surgery, testing, and hospitalization. Most importantly, children get the kind of medicine they need, the kind that works. Osteopathy is the rational alternative. Real doctors, real medicine, real holism, and real prevention. Osteopathy always has been the medicine of the future.